We're gonna show you the Air Powder Polisher. So when you take this thing out of the box, one of the first things that you're gonna do is just squirt it down with air. So you're gonna get this end piece with air, and you are also gonna get the inside of the attachment with air. Once that is thoroughly dried, we can snap that together and we can add the powder. You will take off the cap. There are little inserts that will line up. So there's a metal bar on the inside, and it's gonna line up just like this. And we're gonna give a little push down. Ooh. Ooh. And now we have powder inside of the lid. Really, you guys should do maybe like 2 presses of the bottle, and that should be a sufficient amount of powder. We're gonna put the back cap on, and now the unit is pretty much ready to go. Next thing you'll do is you'll take your line, you'll get a cup, and we're gonna make sure that there's water coming through the line. So we want a nice steady stream of water coming through before you attach the handpiece, because it has to have water. And then we're gonna attach this way. It's a little squeaky. You'll have your foot pedal set to water, and then you're ready to use it. One of the things that we're gonna do in clinic is put a baggie over top of it. Just like that. So if you use one of the light handle covers, it will cover up this part of the unit, which we cannot sterilize. And then you will have access to this part of the unit, which will be sterilized. And then you can rotate that tip. When you're using it, you're gonna have your foot pedal set to water. You are going to be at a 30 to 60 degree angle away from the tooth. So you don't want to be directly on top of the tooth. You want to have a little bit of an angle. You also want to be about 3 to 5 millimeters away from the tooth. Activate with the foot pedal. You're gonna use this in a circular motion, so you're not constantly sitting in one area, because that can start to burn the tooth itself. This can be used subgingivally up to 4 millimeters in your pockets, so you can do that sub. You will also have to have an assistant with an HVE the entire time that you are using this. To tear it apart, we can take the unit off of your hose. These will get less squeaky as you guys use some more. Put that back down. And then there's a couple of pieces that we're going to take apart separately. So I'll start with this one. This one, you will have this plastic piece located in your box. You will insert the plastic piece just like that. There's also a syringe inside of your box, which you're gonna fill with water. You will insert the syringe into the plastic piece, and we are then going to flush the handpiece out. This will help get any residual powder out of that handpiece, so we do not get that clogged. After you do that, we're gonna take some air and we're gonna dry out the inside. Then this can be wrapped and put in the autoclave. We do not put it in the ultrasonic. Next step, we're gonna take this apart. You're gonna take off the back, and you are going to suction that out with a new HVE tip. So the HVE tip that you use for your patient, you wanna get a brand new clean one to suck out the powder. So you're gonna go through, suck out all of the powder on the inside. Then you're gonna go back in with your air. We're gonna spray this piece off. Spray this piece off, and you are also gonna get the cap that's holding that together. So that's just getting any residual powder out of there, and it also gets any residual water out of there, just to hopefully keep the integrity of the unit. This piece you'll just pop back on, and then you are going to take a wipe, and you're gonna wipe this down and put it back in the box. Put this back in the box with it, and your syringe in the box as well with your powder. And that's it.